And then this entire show often is powered by the great Doc Pandya. It's time for Cleared to Play. Take you inside the tent, get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Associate Professor of Orthopedic Surgery, Dr. Nirav Pandya, who also made a great appearance at the Red and Gold Summit, and now your stardom has only grown, Doc.
Thanks, guys. No, it was great seeing the fans out there and seeing you guys in person again. It was a great event.
Yeah, absolutely great to see you. So I've seen also the video that you put out about this. I know a lot of fans had questions when the 49ers sort of, like, they pulled things back a little bit at the beginning of this week as far as Brock Purdy's throwing program. What did you think about that?
I think it's a smart way you're going to approach Brock Purdy going back into playing a live game. And I think barring there being any symptoms or any kind of soreness that is concerning, this is what you normally do when athletes get back to play, whether it's an ACL, whether it's a meniscus, whether it's a shoulder issue. When you're getting ready someone for competition, you want to make sure that they're ready to go, and that's by limiting the throws before they go into a practice. In addition, he just hasn't played live football yet, and it's going to be exactly 6 months when he takes that field against the Steelers. So to limit how much he's throwing isn't a setback. That's just a normal part of reintegrating into sports. No different than a minute's restrictions for someone like Clay or not playing back-to-backs. You want to make sure that body is ready to perform at a high level.
Speaking of restrictions, there's been some talk about Christian McCaffrey maybe getting a smaller workload this season. How much does that limit the risk that a running back has if it's 10% fewer snaps or 20%? Or is football just so dangerous that won't be a factor in possible injury?
I think for the general risk of something kind of traumatic happening, like breaks an ankle or has an ACL, I think, that risk is obviously random. But for the soft tissue injuries, the high ankle issues, the things that kind of come from increased workload, absolutely limiting McCaffrey's workload will be positive, both from a fact of you're decreasing that soft tissue injury risk and you're improving performance as well, too. And if you look at McCaffrey's injury history, the years that he was in Carolina where he had a huge workload or was on pace for a huge workload is when he started breaking down. So the fact that they're going to be limiting it, allowing other players to take the load like Debo, hopefully Elijah Mitchell, Kittle, will lead to better performance and decreased soft tissue injury risk and hopefully less of a chance of something random happening because he'll just be on the field for less plays. So I think it's only a positive when you have a player like him.
Doc Pandya with us here, Cleared to Play, 95.7 The Game with Willard and Dibs every single week. A lot of interesting stuff going on with the Giants to talk to you about as well, Doc. As Kyle Harrison continues to go through his first few starts, they call it stretching him out, right? And we were all, I think, surprised the other night to see him go into the 7th inning. What's safe for him at this point in his career? How long can he go?
Yeah, it's a great question. I think there actually isn't a lot of data in terms of how you integrate young pitchers into the major league. I think the couple different things that you look at, number one is you have to look at how many cumulative throws has he had in general over the past couple of years. You want to kind of mirror what he's done in terms of workload. And in general, you don't want to go up more than 10 to 15% each additional start. But the important thing to monitor is how do they actually feel? So there's not necessarily a number that says once you hit 90, you're out. If his body's feeling well the next day, if he's recovering, he's not having elbow pain, he's not having shoulder pain, then you can gradually increase that up. Where you get worried is where you have a big jump from game to game or that workload from night in and night out consistently is higher what he's done in his career, and then you worry about those injuries occurring.
That's great, and we're all looking forward to him hopefully maybe getting to where Alex Cobb was, where so close, Doc, to the no-hitter, but he threw more than 130 pitches. How much of a negative effect can that sort of a one-time workload be on a pitcher like Alex Cobb next time out?
You definitely do worry about that, and I think where you worry about it is if that next game that you're out, the coaching staff, the training staff have to make sure that if he's feeling anything, are you feeling soreness? It might not necessarily be in the elbow or the shoulder or anywhere in your body. That's where you're going to have that early exit and say, look, we're going to pull you after 1, 2, or 3 innings. It's a big workload, and pitchers just don't pitch that much anymore. So I think that you have to be very, very careful in terms of noticing what he's saying. Are you seeing things like a decreased velocity? Are you seeing less control happening? And those are some of the early warning signs in addition to pain that may say, hey, look, you got to come out. We have to nip this in the bud so something doesn't start happening with more critical structures down the road.
Doc, what about the new Giants outfielders? They are the old Giants outfielders. Yaz and Haniger are both back on the field. Obviously, Yaz had a great first game back, but what should we be expecting from them as they try to get themselves back up to speed?
I think that the transition will be a lot easier for Haniger. I mean, the good thing with broken bones, particularly where they've been fixed and in the forearm, you don't have a tendency to lose much strength. That the return is pretty quick, especially that you've got that plate in there, the bone's protected, you're not dealing as much with soft tissue issues. So as long as his grip strength is good and he's got his confidence, I think that transition will be good. With Yaz, you do get a little worried. I think this is his third hamstring issue this season. This shows why baseball players are so prone to have it. I mean, it's essentially a sport that's set up for hamstrings where you're basically doing nothing for a long period of time and then you're doing things explosively. So I do worry a little bit about that. Will there be potentially another hamstring issue, or is he worried about that happening again? Is he going to change his play because of it? So I'm glad that he had a great performance. Hopefully there doesn't any soreness doesn't impact his play, but it's good to see them both out there.
Brandon Crawford back, Doc, and he'll be in the starting lineup tonight. He's got a left forearm strain that has hampered him. How much does it become a lesser issue, the fact that he throws with the right hand and he bats left-handed, and so that's not his lead arm in terms of hitting the baseball?
Yeah, no, I think that's a great thing for him because there's less grip strength kind of going around that arm when he is doing those things like that. So if there is any kind of residual issues in terms of grip or some soreness, he's not straining it as much, so that does allow him to reintegrate back in and have a higher performance than opposed to if he was really depending that for the power on the bat.
Doc, great stuff. And speaking of great stuff, really looking forward to hearing about and maybe getting a view or at least getting a word or two about the panel that you're going to be on Tuesday, organized by KCBS. Joe Shasky's going to be there as well. A full town hall conversation on youth sports. So what are you expecting to get into there?
Yeah, no, I'm really excited for the panel. The folks, obviously, KCBS 95.7 have put this together. I think it's going to be a great time to talk about where we are with youth sports. What are some of the risks? What's the issues of specializing? What are some of the things that parents, coaches, and athletes have to know about? It's just a topic that, all of us have children play sports, and I think it's important to get down to the science and see how it really impacts all of us and how we can keep kids healthy and playing for their entire life, not just for the short period of time when they're youth athletes.
I tell you what, I think it's a great topic, and obviously, we hear things a lot like baseball pitchers, especially with what Shohei is going through. We hear about pitchers now almost like wanting to do Tommy John surgery. This is not as youth, but maybe in college and whatnot, like wanting to do it almost early because it helps out in their career. What do you think about that?
Yeah, I think a lot of these, they're concentrating just on their performance. What a lot of these athletes don't know is that the reason why these kids are getting better after surgery isn't because you're getting the surgery done, is you spend a whole year rehabbing and working on all these things you never worked on before. You don't have core strength, you don't have good flexibility, you tear your UCL, then suddenly you get better. So you get a little tiny UCL sprain, and all these parents are saying, hey, can we get UCL surgery so we can get back better? And it's really the rehab. So it's about understanding why your performance is where it is, and never wanting surgery to improve performance. It's only really to help you get back from an injury.
Doc, great stuff. We love it as always. We thank you. We talk to you again next week.
Awesome. Take care, guys. Yep.
Okay, there it is. Doc Pandya. The proceeding was sponsored by UCSF Health.
Glad you shouted that out. It's a KCBS function, our sister station, and Joe Shasky III on the panel, a guy who knows a thing or two about youth sports, and Doc Pandya, who's always been an advocate for kids not specializing, especially at a young age. And, you've got athletic kids, especially I think about your young, 9-year-olds? He's still 9,
yep,
not quite
9.
10. And, he's a good athlete. And if he gets to a point here in the next year or two where he pops in any one sport, I know that you're going to be a guy to encourage him to continue to play everything.
No doubt. Yeah, diversify for sure. By the way, if some of you are interested in that event, go to kcbsradio.com. That's where you can get all the details. It is free. It is open to the public. It is from 6:30 to 8:30 in the evening. Again, coming up around the bend on Tuesday night, St. Mary's College in Moraga, and it's all brought to you by UCSF Benioff Children's Hospital. Again, for all details, if you want to consider possibly going, kcbsradio.com. You will find everything there.